Welcome. My name is Dr. Terry Loftus, and you're watching the Robotics program. This program is a program designed specifically for healthcare leaders. It could be a physician, a nurse, it doesn't really matter. But the idea is it's someone who has just been handed a task, and the task is this: build us a robotics program. We just bought a robot. We'd like to develop a program. We hear these are good for the organization and good for patient care, so we would like you to put one together. And you show up your first day and you're thinking to yourself, how do I do this? Where do I start? What do I gotta find? How can I find something out there that's going to help guide me for this? And that's exactly what this program is all about. And I'll go into that story in just a second. But what you're watching right now is just the introduction. And this is broken out in multiple segments, as you probably figured out already. And I think it's probably best if you just take them sequentially. That's how they were written when I originally wrote the book for this. It's called the Robotics Program. It's available on Amazon and Barnes & Noble and Lulu.com. And you can always go out and buy that book. You can get it as an ebook. It's relatively inexpensive. The point of that book, though, is it's a little bit older material. The stuff you're viewing today is going to be a little bit more up to date, and I think is going to be a benefit for your program. So hang on to your seat. We're about ready to take off and go through the robotics program. And thank you for signing up for this program. I think you're going to find it helpful for your success of your program. So the first thing is introduction. My introduction to robotics. First off, my background is in general surgery. I worked for years as a trauma surgeon. I never used a robot in my practice at all. I didn't think I was going to be needed at all. I did some general surgery, and I just never really imagined myself using a robot in the future. What happened, though, is I got out of the regular practice of general surgery and into the administrative side of medicine, and worked as a chief medical officer for years, and was asked to step over to the corporate side. At the time, I was working for a company called Banner Health, a very large integrated delivery network out in the southwest of the United States. And we were based out of Phoenix, Arizona. And so I moved over to the corporate headquarters, and I had a new role. My new role was Medical Director of Surgical Services and Clinical Resources. And what that meant was I was working on the quality side and patient safety side of the house, and also had a role working with supply chain management, helping them understand and develop a value analysis program for the organization. And so that's how I started out. My very first day, or pretty close to that, I was walking through the top floor of the building, and sure enough, ran into one of our chief financial officers, and he asked me, what do you know about robotics? And I said, well, a little bit. I've never used a robot. I'm aware of them. That was about it. And he said, do you have an opinion on them, one way or the other? And I said, no, not really. I'm kind of agnostic to it. I guess I could go either way. I guess it just kind of depends. And he said, you know what? That's perfect, because we would like you to learn everything you can about robotics, but from a different perspective, not necessarily from a user perspective, but from someone who's a healthcare leader, a physician leader in this organization. Help us understand robotics. We've invested a lot of money in this, and we want to know, is this the direction to go? We also want to know, is this something that we should probably get out of? At the time, there really wasn't a good answer, and there was a lot of question about the utility of robotics. And so I got access to a lot of data, and just about everything we had on a robot. We had, at the time, a little over 20 robots in the organization. We ultimately ended up with a little over 20 robots in the organization. Most of those were the Da Vinci made by Intuitive Surgical, but we also had the Mako that we're using for orthopedics. And so I got to see a lot of data, got to learn a lot about robotics, and got to learn about sort of high-level stuff in terms of how organizations look at it. But probably most importantly for this course's purpose, it helped me understand how do you develop a successful robotics program overall? Because we had the opportunity to see a lot of different ways it could be done, and I learned from it. And so taking that data, taking my experience that I had developing a robotics program and helping guide others develop a robotics program at the facility level, and then developing an oversight committee at the system level, gave me a better viewpoint to look at things. And ultimately what we saw was if you organized around robotics, things were better, meaning outcomes were better. And so what this really is it generated a hypothesis for me. The hypothesis is this, and I'll show you the data why I think this hypothesis is probably going to be true. A structured robotics program with specific defined elements produces better quality at a lower cost than a relatively unstructured program. Why do I say that? because that's what we observed. And you probably see there at the bottom of the screen that I've also worked as a speaker for Intuitive Surgical. And what happened was I started talking about this information that I was seeing, this data that I saw, and this hypothesis. And it got the attention of Intuitive Surgical, and they asked me to start speaking for them, saying, hey, could you go out and explain this to people, because this is what we think is going on as well. And we think it'd be a benefit for organizations to understand that, buying a robot is a little bit more than just buying a piece of equipment. You're buying a program, and you have to support the program. And this course is going to teach you how to develop a program that will be one that I think will lead to a much, much more successful outcome for your program. So I just picked this up the other day, and it was interesting how you find stuff in the media out there. And so this is from James Kippenberger, head of market development of Big Hand. Big Hand is a digital technology company out of the United Kingdom. And he was commenting on the efficacy of automated tech has less to do with the tech itself and more to do with how health professionals interact with it. And this is a quote from him. He said, "These projects rarely if ever fail because of the software or hardware." He argues, the key determinant of success invariably relates to human behavior. And that's exactly what we ended up seeing within our organization. And that a lot of times people want to blame the technology when really it has to do more to do with human behavior, and particularly how you organize around the technology that determines whether it's successful or not. And so that's what I want you to leave you with, because you've got to remember that that's going to be a driver of this entire course, is understanding that basic principle. And when we get to the purpose, we'll go into exactly why I think that that's true, and some of the data that I see is supporting that hypothesis. This is out of The Guardian, so you can see the citation down there if you want to go and read the article yourself, but I think that pretty much summarizes it. So what is a robotics program? Before we get into sort of the whys, let's talk about what is a robotics program. I've got a definition here, and I think it's a pretty reasonable one, and you might have a different one, but that's okay. I think we're probably going to agree on most of the points of it. A robotics program is a facility or system-based program which uses a comprehensive, multidisciplinary approach to implementing, supporting, and utilizing robotically assisted technology for surgical procedures. A robotics program is the overarching structure, whereas a robotics committee is the formal executive arm which provides oversight in determining how that structure is integrated into the system and how it performs. The structure is primarily composed of 7 core elements referred to in this program as the 7 pillars. And it's an interesting story how I derived that concept of the 7 pillars, but I'll tell it to you as we get more and more into the course. So what are the 7 pillars? First off, we'll talk about the specific 7 pillars, but what are they just generically? They're higher level elements that differentiate successful programs from unsuccessful programs. And so what was happening is I was able to look out across our organization and see that the outcomes were different based on which facility you were at. And so you could have really, really great outcomes in terms of low complications and low costs, or you could have not so good outcomes in terms of the other direction. And so it really came down to what's driving that. And the first thing everybody said was, well, they just have surgeons who are busier, and the busier surgeons are better, and that's why they get better outcomes. But that didn't explain it all. We found programs that had busy surgeons, and they weren't always necessarily that good. We found programs that had less busy surgeons, and they were actually outstanding. And so what was driving that? If it wasn't necessarily surgeon volume, what was driving that? Although I am a believer, I do think that the busier a surgeon is on the robot, I think the better their outcomes are going to be. And I think that we have some data that back that up as well. But we also started to see this other thing happening, which was something is shaping outcomes that's not necessarily related to volume on the basis of a surgeon. And we started looking around and asking, what are you guys doing? Meaning I sent multiple surveys out and wanted to know what people are doing. And what we're going to talk about when we get to the 7 pillars is what the results of that survey was. The 7 pillars serve as a foundational structure for a successful program building, meaning you take these 7 pillars and you build a successful program. And I'm going to show you how to do that, because this is exactly what we found ourselves doing. Almost by default, we were sort of back stepping into it and forward stepping into it later on when we figured out that that's the key to success. It focuses leadership on the organizational elements required to build a successful program. So you're starting out your program, you're trying to figure out, how do I do this? How do I make this thing successful? Well, what you want to do is be able to say, I have some fundamental model about how to build this program. And I'm going to build on that model, and then you're going to change pieces of it as you need to. And what I mean by this is the 7 elements are going to stay exactly the same, but you're going to figure out ways to customize it to fit the program that you're trying to build. And so the key thing to remember about this isn't just 7 pillars for a robotics program. It's for any program. And I've got a couple other programs out there right now. I've got a value analysis program and a clinical practice program that I've also built the 7 pillars into. And so this model serves as a guide for developing programs. It's transferable from program to program. You build a successful robotics program, and guess what? You can go on and build a successful value analysis program. In fact, actually, I'm going to tell you right now, you don't even have to buy the book, and I'm going to have a course on value analysis and clinical practice programs. Yet you're probably not even going to have to watch any of those course materials. And the reason is because once you figure it out in one program, you'll be able to transfer it to another program. It also helps healthcare leaders become successful by building a useful skill set, program building. It produces better quality. This skill set is going to produce better quality, improve utilization, and cost savings. And the nice thing about it is there's a lot of turnover with physicians. They say like 50% of physicians go on to another job after they finish their first job and after following residency, meaning within about 2 years, 50% turnover, and they're going to move on to another job. And so the question really becomes are you building a skill set along the way? And if you are, you want that skill set to follow you around. Why? Because if you set up a successful robotics program on the East Coast, then you can go to the West Coast and build a successful program. It goes with you. And not only that, but that trail of success is applicable to other programs. So if you get into something else and you want to develop, say, a bariatrics program, you can do the exact same thing with this. You just take the model and you start to plug and play and figure out how it's going to be able to develop into a successful program for you, for your needs, wherever you're at any point in your career. So that to me is really kind of the nice thing about this is it's transferable. So here they are, the 7 pillars. And you can see, first off, they have a mnemonic that spells special PI. You can kind of see it over here on the left-hand side if you look at the first letter of each word. But the S stands for 7 pillars. The P is for purpose, E, engagement, C, communication, etc. And it just goes down. And you're probably looking at this list going, yeah, okay, Terry, I get it. This list seems pretty obvious, doesn't it? I mean, you have all that built into it. You have a successful program. That's not what's amazing. It's not that these 7 elements are essential for successful program building. What's really amazing, very few programs build it into their program. Even though they know these are things that are important for your program. It's amazing how many times people do not take these and build it into their program. So I'm going to teach you how to do that. We're going to go through every single one of these elements, and I'm going to explain to you how it applies to a robotics program. And as you do that, you're going to begin to realize that it's really sort of the mixing of all 7 together that really drives the success for the program. You could pull 1 or 2 out and sometimes have success with programs, but man, you miss too many of these, your programs are doomed. And I can't tell you how many times I've been called in and someone said, hey, Terry, we want you to join this committee. They're going to do this. They're going to work on this program. And I'll say, okay, I'll take a look at it and let you know if I want to be a part of it. And I'd go in and within 30, 40 minutes of sitting in a meeting, I could tell you whether it's going to work or not. And I would make some suggestions about how to prove it. They say, no, we have a different leadership structure and they want to do it this way. I'd say, good luck. And then I would just say, I'd kind of back out of the program because they were doomed. They weren't going to go anywhere. And that was, for me, when it was sort of like I started to begin to see what was driving successful programs and successful projects for that matter, because in some ways they're exactly the same. So in purpose, we want to know what the understanding why our program exists, engagement, motivating stakeholders to achieve success, and I'll go through sort of the 10 rules for successfully engaging physicians, communication, educating, learning through mutual feedback loops. It's really important to be able to listen to people, and I'll give you several examples of how that works. Infrastructure. This doesn't work without a strong foundation. You just have to have that infrastructure in place. You don't have the infrastructure, the chances of success are very, very, very slim. So that's going to be a very important one. Accountability. You have to have an informed governance, and every organization has its governance structure in place. You have to plug your robotics program somewhere in that governance structure. You have to have it in there. Leadership. It goes without saying. In Banner Health, Peter Fine was the CEO. Had a saying, he used to say, leadership matters. He was just constantly reminding us of that. Why? because it's extremely important. Leadership does matter. Your leadership in these programs is going to determine its success. It really is. It's building trust in competent and inspirational leaders. That's what we're trying to do for you, because you have to become a leader. If you're watching this program, you are probably either already on track to become a leader, or you are a leader and people are expecting you to know this stuff. So I think that's going to be a key one as well. And then performance improvement. The whole reason we're doing this is because we want to get better through intentional effort. So if you have any questions, and I'll try not to keep repeating this after everyone, but you always see this at the end of each slide deck. But if you do have any questions, please contact me, Dr. Terry Loftus, at terryloftusmd@gmail.com, or you can visit my website, www.loftushealth.com. And feel free to send in any questions, comments, concerns. If you see any typos in my presentations, or if you hear me slipping while I'm talking, then let me know. I'll be able to go back and change it up, make it better for the next crew who comes through and sees the program. But I want to thank you, and please go on to the next section. I think you're going to enjoy it.